Hey everyone, this is Jason from Intricate Art Seminars. You can check us out at intricateartseminars.com. I just wanted to talk to everybody today about erectile dysfunction, right? So this is a big problem for a huge percentage of guys. So I was just looking at this at the worldwide stats and at the USA stats, and they estimate that 40% of males of the age of 40 have some type of erectile dysfunction, and then that percentage increases 10% each decade. So 50% of 50-year-olds, 60% of 60-year-olds, and so on, right? So that's a huge problem, right? So there's like 350 million people in this country, let's say. So let's just say half of those are guys, right? So like, 175 million people, and then take 40% of those or so, right, in general. That's a lot of people, right? That's like almost 100 million people, 100 million guys that are suffering, for the most part, totally needlessly from erectile dysfunction. And the major reason that nobody knows that this is a totally fixable treatment is because, as usual, the pharmaceutical companies want to bury and make sure that nobody knows that there are permanent, easy, cheap, non-pharmaceutical treatments out there for common impairments like erectile dysfunction, right? So Viagra was initially being studied as a heart medication, as a blood pressure medication to vasodilate and allow the heart vessels to have more blood going through them, right? And they found an unusual side effect. So they realized that Viagra was a really good vasodilator of the arteries down in the genital region, especially obviously for guys, right? So they repurposed Viagra to use it as an erectile dysfunction drug, and people need to take it for life because Viagra does not treat or focus on the cause of erectile dysfunction, which is very, very simple, right? Viagra just focuses on the symptoms, and it's temporary, and that's why guys have to keep taking it all the time, right? So there is a really easy permanent fix for this. So just like with incontinence, unless you have some type of significant underlying pathology, there is no reason that men should have erectile dysfunction, right? At any age, really. So the way that erectile dysfunction works, right? There's a couple. The way that erection works is really easy, right? So you basically need to have more blood going into the penis than you have coming out, right? So you need to have more arterial blood going in than venous blood coming out. And the way that you maintain an erection is with sufficient arterial blood supply to the penis, right? You get a passive internal increase in pressure. And so arteries have thick walls to them. They have an endothelial layer of smooth muscle, right, that holds in our blood pressure. But veins have little valves in them like this, right? So the veins, the way blood returns through veins is with the blood pressure, the valves open and then they close so the blood can't go backwards, right? So with enough pressure on the outside of those valves, the passive pressure from the arterial blood supply, those valves get shut so the blood can't exit the penis, right? So you need to have enough blood flow going to it in the first place, and then you need to have enough internal pressure in there to passively close the venous valves so you don't have venous leakage out the backside of the penis, right? So the major problem with erectile dysfunction, just like with incontinence, is sympathetic hyperactivity of the autonomic nervous system along with pathology of the pelvic floor musculature. In men, specifically for erection, the two most important muscles, although there's a lot of important ones, the two most important muscles to be normal and functioning well are the bulbospongiosis and the ischiocavernosus. Right? So those, the bulbospongiosis is right at the base of the penis, the ischiocavernosus is just off to the side, and those two muscles need to be soft and pliable and in homeostasis so they can fill with blood and contract, right? So what happens with most human beings are living with sympathetic autonomic hyperactivity. That's just the natural response of the human body to stress, any type of tissue damage, mental trauma, mental stress, anything like that, right? So most people on the planet are living with sympathetic autonomic hyperactivity, which just dysfunctions the entire body. But since we're talking about erectile dysfunction, The main problem with sympathetic hyperactivity with erection is that sympathetic hyperactivity leads to excessive acetylcholine, which leads to excessive muscle contraction, right? And also allows excessive calcium to be put inside the cells, and there's very little acetylcholine esterase that's made with sympathetic hyperactivity, right? So when you get chronic sympathetic hyperactivity, instead of just the presynaptic cleft releasing ACH to the postsynaptic cleft, typically only the postsynaptic cleft is receptive to ACH, right? With sympathetic hyperactivity, there's way too much ACH getting pumped out from the presynaptic cleft, and instead of the postsynaptic cleft just being receptive to ACH, the whole muscle epimysium, the whole muscle lining gets receptive to ACH. So then you get like a slow chemical shortening of the muscle. You also develop trigger points in the muscles, which are hypoxic, right? So sympathetic hyperactivity leads to chronic tightness of the pelvic floor muscles, right, which limits blood flow, and it does not allow blood to circulate into the muscles, so they become more rigid and hypoxic and they don't function well, right? So one of the most hardline facts that we know about dry needling at the moment, right, is that it is excellent at inducing autonomic homeostasis, and it is the fastest tool that we have to normalize soft tissue and increase blood flow, right? So we know that needling increases blood flow in soft tissue by up to 20x, right, after about 5 minutes of having needles in there. So again, erectile dysfunction is very simple. It's a problem with tight muscles and a disruption in your blood flow, which are both due to sympathetic hyperactivity of the autonomic nervous system, right? So dry needling is extremely comfortable in this area. You guys don't worry about it. I get needled down there all the time. It sounds like a freaking horrible idea, but it really, really is comfortable. I was just needled down there this weekend probably 100 times, and I barely felt any of them, right? So by directly treating the muscles with needles, which you can't do any other way, right? The only direct way to treat muscles is with needles. It's very comfortable. So if you directly treat the pelvic floor muscles along with targeting the parasympathetic autonomic nervous system with needles, so like the upper cervical spine and the ear, right? You can totally fix erectile dysfunction problems in the vast majority of people that are suffering from them. It's really, really simple. I do it all the time, right? So dry needling, if you're suffering from erectile dysfunction and you haven't tried dry needling, you have not tried the correct treatment, because dry needling affects or addresses the underlying cause of the problem, where Viagra and other pills just address the symptoms, right? So dry needling is actually addressing the musculature that's tight and aggravated, while at the same time, if you know how to treat properly, you can directly address the parasympathetic autonomic nervous system, which leads to autonomic nervous system homeostasis. It allows the muscles to fill and swell with blood better. And it does this all over the body, right? Not just in the genital region, but dry needling is the fastest, best, most permanent fix for erectile dysfunction that exists on planet Earth right now, in my opinion. It's really amazing. I see awesome results with it all the time. All right, guys, thanks for watching. You can get a hold of me if you have any questions about anything. It's not easy to find anybody that treats for men's pelvic health, which is a huge problem, right? So this is an area that I would really like to get out there. If you're in my area, I can help you. If not, I have trained a handful of people, and recently a lot of guys actually, which is nice, that are doing pelvic health treatments. So if you're a patient suffering from this, or if you're a practitioner looking to learn more about how to treat pelvic health with needles, it's very comfortable, it's very easy. You can fix and cure erectile dysfunction for the vast majority of people, as long as they don't have a significant underlying pathology like a spinal cord injury or something like that. So get a hold of me, Jason@intricateartseminars.com, and you can check us out at intricateartseminars.com. Thanks.